Hello, future doctors! Today we're going to tackle another USMLE Step 1 question. This time we're focusing on a 50-year-old man with increasing daytime somnolence. Let's dive in. A 50-year-old man comes to the office because of a 2-month history of increasing daytime somnolence. He has obstructive sleep apnea, for which he has only intermittently used a continuous positive airway pressure, or CPAP device. He is 170 centimeters tall and weighs 181 kilograms. His BMI is 63 kilograms per square meter. His temperature is 37 degrees Celsius, pulse is 100 per minute, respirations are 12 per minute, and blood pressure is 135/80 millimeters of mercury. Physical examination shows a gray-blue tinge to the lips, earlobes, and nail beds. Cardiac examination shows no other abnormalities. Arterial blood gas analysis on room air shows a pH of 7.31, PCO2 of 70 millimeters of mercury, and PO2 of 50 millimeters of mercury. Which of the following additional findings would be most likely in this patient? Let's break down this question. First, we need to analyze the patient's history and clinical presentation. The patient has a 2-month history of increasing daytime somnolence, known obstructive sleep apnea with poor CPAP compliance, and obesity with a BMI of 63 kilograms per square meter. Physical exam shows cyanosis, indicated by a gray-blue tinge. Arterial blood gas analysis shows respiratory acidosis with a pH of 7.31, hypercapnia with a PCO2 of 70 millimeters of mercury, and hypoxemia with a PO2 of 50 millimeters of mercury. Which of the following additional findings would be most likely in this patient? 1. Decreased serum bicarbonate concentration. 2. Decreased serum chloride concentration. 3. Decreased serum potassium concentration. 4. Elevated serum bicarbonate concentration. 5. Elevated serum chloride concentration. To answer this question, we need to understand the pathophysiology of chronic respiratory acidosis and compensatory mechanisms. Option A, decreased serum bicarbonate concentration. In chronic respiratory acidosis, the kidneys compensate by retaining bicarbonate to buffer the excess hydrogen ions. Therefore, we would expect an elevated, not decreased, serum bicarbonate concentration. Option B, decreased serum chloride concentration. Chloride levels can decrease in metabolic alkalosis due to vomiting or diuretic use, but they are not typically decreased in chronic respiratory acidosis. Option C, decreased serum potassium concentration. Potassium levels are not directly influenced by respiratory acidosis. They may vary due to other factors but are not typically decreased as a direct consequence. Option D, elevated serum bicarbonate concentration. This is the correct answer. In chronic respiratory acidosis, the kidneys retain bicarbonate to compensate for the elevated PCO2, leading to an elevated serum bicarbonate concentration. Option E, elevated serum chloride concentration. Chloride levels do not typically elevate in response to respiratory acidosis. They may be affected by other factors, but not directly in this scenario. Therefore, the most likely additional finding in this patient is an elevated serum bicarbonate concentration, reflecting the body's compensatory response to chronic respiratory acidosis. And that's how you approach a USMLE Step 1 question on chronic respiratory acidosis and its compensatory mechanisms. Make sure to focus on the pathophysiology behind the symptoms and lab findings. If you enjoyed this video, please like, subscribe, and hit the notification bell for more exam tips and tricks. See you next time.